Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, January 21st, bringing you the update from Albany Med. Fred, we both have on our white coats today.
We do.
Yes.
Yes, we look very professional.
Doctors in the house.
Doctors
All right.
in the house.
First graph, Capital Region, 8 counties. You can see the number there. We're at 553. Same number as it was yesterday.
That's right.
Next graph here is Albany Medical Center admissions and discharges. And Fred, I think the term you use is we are in balance.
We are.
Admissions and discharges basically the same.
That's right, Dennis.
That is, in fact, what Dr. Hanks down at St. Peter's says each day about St. Peter's as well. So that's.
And really, the whole region is there. The whole region's in balance.
So then the third graph here is the morning census here at the medical center. The number is 141 in the hospital diagnosed with COVID. There's 27 in the ICU and currently 7 on ventilators. And we say this at least once a week, no flu.
No flu.
No flu. No flu this season.
Still no flu.
Maybe COVID is sort of the strain that's out there.
Yeah, the dominant virus.
Fred, we talk a lot about the regional numbers. We talk a lot about the medical center numbers. Today, we'd like to talk a little bit about the state and national numbers because, obviously that gives us a picture of what's happening. So let's start with this. So you want to go with national or state first?
Yeah, let's go with the national.
Okay,
Let's
so what do you have for us?
So Dennis, there's a site, it's called the COVID Tracking Project, where there's a lot of data on what's happening nationally. You can even drill down to the state level. So if you look at that site, there's a 7-day average graph.
Yes.
And the 7-day average of both cases and hospitalizations has already peaked in the country.
Yes.
It peaked on the 11th of January, so about 9 days ago, 10 days ago. So that's actually
the
good.
national number.
That's the national number.
Okay.
Yep. And actually, single day highest number of hospitalizations was January 6th at 132,000. Yesterday was 122,000.
Excellent. All right.
Yeah.
And
Progress.
so this is certainly encouraging. Now, nothing would suggest that we're absolutely on the backside forever, but it is encouraging that the numbers are coming down.
That's right.
All right, and so we think that those are graphs that we can actually even share as well.
That's right. And then on the state level,
Yes.
Sort of the same thing. The 7-day average peaks are around the 12th for cases, and we're not quite peaked for hospitalizations, but it really does look like we're plateauing,
All right.
which again I think is a positive. Doesn't mean you shouldn't get vaccinated. Doesn't mean you can stop wearing your mask or washing your hands or social distancing, but we're headed in the right direction, I think.
Excellent. All right. Well, good news, and we'll since those are state and national numbers, we'll maybe take a look at them again next week. Let's talk about some other good news. Fred, one of the things that we've been trying very hard to do is to take care of everything that we have to do here on this campus with the workforce that we have.
That's right.
And as we've talked about on the video, we've been challenged, as have all hospitals in the region, the state, and the nation, to have enough members of our workforce here on campus to care for the patients. And the main primary reason why we've been challenged with that is because we've had increasingly, in the last several months, people who have either been diagnosed with COVID or been exposed to COVID who've had to be at home quarantining.
That's right.
So there's really 3 things that are currently happening which are driving the number of people that were at home back on campus, which is very good. And that's very good because there's certain services that all hospitals have had to slow down. That once we get to the point where the staff is back on campuses in larger numbers, we can turn back on again.
That's right.
So we're not there yet, but we're moving in the right direction.
That's right.
So let's talk about what those factors are that's turning that around. The first one is obviously the prevalence of the virus in the community. The positivity rate of people seems to be going down.
That's right, Dennis.
And that's similar to the numbers you just talked about
That's
before.
right. And that's been for probably 7-10 days now that's been going down.
A second one obviously is vaccination, and we're very proud that a significant percentage of our workforce has been vaccinated. Fred, what's that number these days?
It's probably 82%, Dennis, first dose, and I think we're at almost 40% second dose now.
And we're listening very carefully each day to the numbers about how many members of our workforce are testing positive for COVID, and that number is definitely going down.
So we peaked back in the beginning of January at 38 in
Right.
one day. Today it was 5.
Yeah, I think every day this week has been single digits.
That's right.
Right.
That's
And then the third thing is something called a waiver. And Fred, I'm going to have you explain this primarily because I want to give you credit because you are really the driving force behind getting this waiver approved for the medical center.
Well, I just was very annoying, and that's how it ultimately happened. So back in the latter part of December, I think around the 26th or so, the state put out an executive order that said if you are a healthcare worker and exposed, you had to be quarantined.
Right.
Now, up to that point in time, Dennis, you know this, we were allowed to bring those healthcare workers back with some very careful monitoring.
Right.
So the state changed the rules.
Right.
And they, for a time, just had that in place. Around the 7th of January, they decided maybe they needed to have a waiver program because there would be institutions that would be significantly impacted by that quarantine rule. So they opened that up. We applied for a waiver, and we were granted a waiver last Friday.
Fantastic.
And what the waiver does, it allows you, if you're quarantined, so let's say you were exposed someplace, you got a quarantine letter from Albany County as one of our employees, you can travel back and forth to work, you need to mask, you need to be tested both before you come back as well as periodically, but you're still quarantined for other activities. You can't go to the supermarket, the drugstore, those kinds of things.
Now, the waiver does not impact individuals who have a family member who's COVID positive.
That's right, Dennis. In our experience, if you have a family member or somebody you live with who's positive, very high likelihood you're going to get infected.
Right. So we already had determined that to be high risk.
That's right.
So Fred, reduced prevalence of the virus in the community, increased vaccination in the community. We think both of those numbers are going in the correct direction.
Absolutely are.
And the waiver. So with all three of those in place, what is happening to the numbers of individuals who were at home who are now coming back to work?
So Dennis, if you go back a week, 10 days, somewhere in that time frame, we had 230 staff out
230.
with some kind of COVID-related issue. Either they were infected or they were on quarantine. Of those 230, about 160 are part of our clinical care team. So think nurses, PCAs, those kinds of individuals. Yesterday, in that latter group, the clinical care group, 33.
Incredible.
Yep. So dramatic reduction, which is really going to help us in terms of care delivery.
And I know that many people, including Dr. Philhauer, are looking very carefully at that. And although we can't flip it with a switch, there are plans being put into place to say, now that we have more on campus, what can we turn back on again?
That's exactly right. They're developing a very thoughtful plan of step-by-step, how can we undo some of the redeployment and closure of activities.
Excellent, excellent. All right, very good. Let's end on two what I would call positive stories. The first one is we were recognized for, I think it's the seventh straight year
in a row.
Albany Medical Center recognized as Most Wired. Most Wired. Now this is a recognition given out by something called CHIME. College Healthcare Information Management Executives. Obviously, George Hickman, our Chief Information Officer, is at the head of that team, and we're very proud of them, and we give them a lot of credit.
Congratulations, George, and congratulations to your whole team.
Right, absolutely. So Most Wired, 7 straight years. Congratulations to them. And then, Fred, the last item is really what I would call a really nice way to end the week with a great story. And you're the one who'd like to bring it to us.
Yes. So actually, this is a story that Dr. Verdile, the dean, told me. It's about one of our medical students who happened to be in line in the pharmacy, the outpatient pharmacy last week. And in front of him was a young woman who'd just been discharged, and she was there to try to get her discharge medications. And she didn't have the money to pay her co-pays. So the pharmacists were trying to help her. They offered to send her prescriptions to her hometown pharmacy and a number of things they put on the table to try to help her.
Right.
And this student was listening to what was going on and stepped forward and said, I'll pay her copays.
Wow.
And so out of pocket, he paid for her prescription so she could go home safely. So this is a shout out to Benjamin Gallant, one of our medical students. Just absolutely, I'm so proud of you for having done that. Thank you.
Thank you, Ben. Random act of kindness.
Random act of kindness,
right.
Yeah. And this is, something that we need more and more these days.
I think you were saying, pay it forward.
Pay it forward.
Yeah, good for him.
Yep.
All right, wonderful. I think that speaks to the character of the type of students that we accept here in this college, for sure. All right, we'll end on that note because it's a good note. And obviously, we'll be working all weekend, as we often say, with the teams, taking care of everyone here in the hospital. Our missions continue, and we'll be back again next week.
Next Tuesday.
All right, very good. We ask that you once again, please take care of yourself, take care of each other, and we'll see you on Tuesday.